The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. I had a question that came in, a couple that Marina wants to make sure that I get to. This parent wrote in and said, we're relatively new to ABA, 6 months in. What do you think is the role of the supervisor in ABA? We have a team of 4 BCBAs at home, 30 hours, no BTs. However, there is a managing BCBA that sets the programming and does parent training based on data and feedback from the therapists, who I'm assuming are the other 3 BCBAs. My concern is the supervising BCBA never sees my son in person, only once at intake. Is this usual that the supervising BCBA doesn't see him in person? I feel like a lot of the nonverbal communication issues are hard to convey without seeing a person. Also, the therapists don't have team meetings to discuss my son together, what's working and what isn't for them. It seems like that would be so helpful. Is that typical? The supervising BCBA has always said the outcome is dependent on how fast he moves through the programs. This makes sense. Also, how do I quantify this? I see his graph from the data weekly, but there is nothing more that I can request. The therapists are all telling me he's moving through goals quickly, and hopefully this continues, but I wish there was something to benchmark his progress against. Are there, and then there's one more, they apologize for so many questions, but I love them. Are there any more studies or updated data that you can share to show similar to the Lovas study? As mentioned before, we are at 30 hours, but I would like to increase to 40 hours. My husband will need some convincing, so it would be helpful if there is more data to show them. And they say, sorry for the numerous questions. I greatly appreciate all the time and love you put into your show. I stumbled upon it a few days ago and listened for hours already. Thank you. So I will just say about the studies, and then you can say this, Dr. Granpeesheh. I keep a thing of 6 studies on my computer for whenever parents ask for studies that are like, and they're aging now. None of them are brand new, but they're like the 6. I call them the 6 seminal, because pretty much if you're going to court or talking to a parent, each one of them covers something. So if somebody needs those, just write to me, write to me at shannon@autism-live.com, and I can send those to anybody. But go ahead, Dr. Granpeesheh. What do you want to answer first?
Sure.
The thing about the BCBAs?
Oh my gosh, there's so much to answer, and this is such a very awesome question from a parent who very clearly gets it. So thank you for joining us, and thank you for your kind words about our show. It's meaningful that when we're able to help. There's a lot of things about your program that don't sound normal. Let's start with the fact that you have BCBAs doing therapy. So the BCBAs are kind of like doctors in the field of ABA, right? So they're the ones that have been trained to, mainly they have learned how to design programs to change behavior, both positive and negative behavior. So they are not trained to do therapy. I mean, at least I'll tell you that at CARD, one of the things that we are doing is we're trying to get our BCBAs to do more therapy just so they stay involved with the child. But generally speaking, in any program, a BCBA will come in, they'll do the intake, after the intake, they will do kind of a assessment of the child and in all environments, and whether that's based on observations of the BTs, the behavior technicians, or their own observations in different environments. They'll do all of that. They'll make a kind of a assessment of the child, and a lot of times the assessment has to do with what the child's capabilities are in the beginning when they first meet the child. Now they'll be using different types of curricula out there. So we at CARD use a what I consider to be extremely sophisticated and very highly developed curriculum that we worked on for many, many years called Skills. And that does start with an assessment of exactly where your child is on every different functioning level. So where they are in language, adaptive skills, cognitive skills, etc. And then that is kind of your child's baseline. And then we add from there to try to get them to their goal. And their goal is always going to be their chronological age level. So this is where they start, is where they are now, where they hopefully end up is what other kids their age are doing, right? And that's our goal. So with other people, they're using lots of different things that are out there, like the VB map or WebAbles or other things that are out there, and you should ask what curriculum they're using. And every curriculum generally should have a output. So in other words, ours is kind of what are other kids this age doing? And others might have like, these are the series of lessons we want to teach the child for whatever reason they're based on, whatever they're validated for. But they should be able to show you this is what we want to teach, and this is how your child's progressing towards that, right? So what you're seeing is how your child's progressing. Those are the graphs, but you don't know what the overall universe is, and that's very, very important. Shannon, I remember you telling me like one of the things that Skills provides that's extremely valuable to parents is like it's kind of, you compared it, I think, to the directory in a mall,
Yeah.
right? And it's like these are all the places I have to go. These are all the things I have to do. Now, how do I get to each one?
Well, where am I? Where am
Where
I
am
to
I?
start?
Where am
I
I?
want to see
And I
that
think,
you are here.
yeah, and that's exactly where what the parent is asking is like, where is my child in the universe of other kids, right? And in contrast to other kids. So it is unusual to have 4 BCBAs. That just doesn't happen because BCBAs are supposed to be designing programs and they're the ones that are supposed to be supervising programs. So I don't know what agency you're at where they are only using BCBAs. I guess some people would say that's higher quality, but in my mind, it's a little odd, to be honest, because it's like using 5 doctors, and doctors are not always as good as nurses at certain activities, you know? So I think you definitely need one doctor to be running the show. That's the other thing. You don't want like multiple cooks in the kitchen either. And there's going to be confusion on what should happen next. So typical programs, you'll have one BCBA who's in charge and you'll have a team of RBTs, registered behavior technicians. And the BCBAs are master's or doctoral level, and the RBTs are bachelor's level. Or lower than bachelor's, actually. You don't need a bachelor's in order to have an RBT certification, but you do need training. Now, the team, in terms of how the logistics work, if you have, how many therapists did she say she has, Shannon?
It says
I
it's
think
a
she said-
team of 4,
and it's
and
30
no
something hours,
BTs for 30 hours.
Yeah, I mean, that's a really good ratio. I would expect even more than 4, but if you have 4 people doing 30 hours, that's pretty good. I mean, that's really good. It's usually you'll have, maybe 5 or 6 people even on a case doing 30 to 40 hours. So that's one thing. The second thing is whoever is the supervising BCBA needs to have ongoing contact with your child and with the others. So they cannot rely on just reports. They need to see your child. This is, okay. So in the old days, we used to have the luxury of doing something called clinic meetings. Clinic meetings are when the entire team gets together with the child and the parents, and you all meet, and every individual demonstrates what they're doing, and so on and so forth, right? And so the supervising person can say, oh, this is good, this is bad, let's change that. The child is struggling with this, he's doing really great, you're not rewarding enough, whatever. The whole gamut of feedback that you want to give your team. Unfortunately, health insurance does not allow that. Health insurance will not allow 4 or 5 people with the same credentials to be present with a patient at the same time, which is kind of ridiculous. They allow it only in certain situations, like a surgeon and an anesthesiologist, obviously, but not with us, not with ABA. So what has to happen is they do allow one BCBA overlapping with one behavior technician, not with another BCBA, but with a behavior tech. So what happens is normally what we have to do is the BCBA has to do 1 hour with behavior tech 1, 1 hour with behavior tech 2, 1 hour with behavior tech 3 over the course of the week. That way, the BCBA gets to see the child multiple times and is hopefully working on trying to keep all of the team consistent with each other. So, and it's an unfortunate thing. I still strongly believe that if they allowed clinics, it would be cheaper for them and it would be more beneficial to the client, much more beneficial. But we were not able to get them to understand that, payers, the insurance world. So that is something, if you're paying privately, which I honestly have no idea how this organization is providing you 4 BCBAs. I don't know, that's kind of an unusual situation. Anyway, so whoever is in charge needs to be constantly talking with you and constantly talking to the behavior techs and moving the program forward. I don't know how that's possible without seeing your child on a regular basis. And the other question I was saying is like, they should be able to offer you some guidelines or some visuals in terms of where your child is actually headed. What are the goals? You need to know the goals, not just the progress. You need to ask them, what are the goals here? And if you are still not content with that, or if they're not able to respond to you, I would ask them to give you all the assessments that they need to do every 6 months, because health insurance does require certain tests be done every 6 months. One of those tests is the Vineland. You might be answering questions for them on the Vineland. It's not as good as a test that they would administer to your child directly, but nevertheless, it is some form of tracking how your child is improving in different areas. So that's kind of what you want. You want to talk to the lead supervisor and say, hey, how are you programming my child? If you're not seeing him, I need you to have more contact. Secondly, I need to know what the goals are so that when you guys show me progress, I know whether we are reaching the goals or not. And if you've done any assessments, please send those to me as well.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.